Today, I would like to talk to you about frequent urinary tract infections. We all get one or two urinary tract infections at some point in our lives. But sometimes some people get urinary tract infections several times per year. It could be due to the sexual activity, due to the medication they're taking, or due to the menopause. So, what can be done if you are the person who's having this frequent urinary tract infection? Well, first of all, let's define what it means. So if you have two or more of urinary tract infection within 6 months, you consider to have a frequent urinary tract infection. We usually evaluate why it happens. Is your urinary tract infection related to sexual activity? Some women get urinary tract infections because they're in menopause. But let's take it one step at a time. The first preventative level is to take a cranberry supplements and vitamin C. Cranberry contain a compound called proanthocyanide that prevents adherence of bacteria to the bladder wall. And by doing that, it prevents urinary tract infections. If you can take any cranberry supplements that's out there, I would highly recommend to take Illura. The company that made Illura specifically extracted the active ingredient of cranberry and put it in capsules so you know exactly how much of the cranberry you take. And you take that supplement every day, one pill, and on the days when you're sexually active and the day after, you take 2 capsules. When you add vitamin C, it actually potentiates the activity of cranberry supplement. And majority of women doing pretty well on just cranberry supplement and vitamin C. So the second level of protection is to add antiseptic. And usually it's done when there have been a breakthrough urinary tract infection while taking cranberry supplements and vitamin C. The really good antiseptic that we use called Heprex or metenamine. You take 1 pill twice a day, and it's very important to take it 12 hours apart to maintain the concentration of that antiseptic in your body. Some people might experience heartburn, but it's usually well controlled if you take medication with food. You don't really need to take antiseptic forever, but at least you need to give it a try for 3 to 6 months. And when you're UTI free, then we can start trying to taper it off. Another very important preventative measure is to use vaginal estrogen. Vaginal estrogen is very helpful in perimenopausal, postmenopausal women. And it's very important to emphasize that you do need to take the vaginal estrogen consistently in order for them to work. And then reevaluate in 2-3 months. If you have been UTI free, then we can try to wean you off from the supplements, from the antiseptic, and just keep you on the vaginal estrogen. That's how potent they are. Premenopausal women might benefit from the vaginal estrogen as well. If you're someone who have been taking oral contraception pill for a prolonged period of time, you might actually experience the same vaginal and bladder changes that any perimenopausal, postmenopausal women. So in those cases, adding some vaginal estrogen can also help prevent urinary tract infections. But what if you're only having urinary tract infection after sexual activity? Well, in those cases, taking medications every day can be quite daunting. So it might be helpful to just take one small dose of preventative antibiotics anytime you have sex. And you might be asking, will you ever stop having urinary tract infections? Well, it depends. For some women, their bodies will adapt and learn to fight off the infections better, but some women will continue have urinary tract infections. For those women, you will need to continue taking preventative measures. Can UTI be transmitted through sex? While urinary tract infection is infection, but it's not sexually transmitted infection. You can't pass your UTI to your partner. However, because of the sexual activity, because of the proximity of the urethra to vagina, increased lubrication, a lot of action happening in that area, because of that, urinary tract infection can be triggered by sexual activity. Also, a lot of women ask if there is anything they can do to prevent urinary tract infection other than taking medications. Well, there's a lot of talk about emptying your bladder before and after sexual activity, which can definitely be helpful in flushing your system, but it's not a very reliable method on preventing urinary tract infection. Taking a shower, it's obviously good to take a shower, but again, it's not guaranteed that it will help prevent urinary tract infection. Some women use antiseptics, topical antiseptics on themselves and their partner. I strongly advise against doing that because by doing so, you're actually killing your own microbiome that prevents you to fight urinary tract infection and any infections. Can you get infection by sitting on a cold surface? Growing up in Russia, this is a very familiar statement to me. Well, you know that feeling when you go in a cold environment and you feel like you need to pee more often? While you might experience some urgency and frequency, some bladder irritation, it doesn't mean that you actually have a real infection inside of your bladder, and you do not need to take antibiotics for that. Are there some antibiotics better than others for urinary tract infections? The best way to determine what antibiotic works for your UTI is to check your urine and send it to the lab for urinalysis and urine culture. On urinalysis, we can see if there is any signs of inflammation and infection. And urine culture will tell us what exactly bacteria that cause the UTI and what antibiotics would work best for that bacteria. Bacteria can develop resistance with time. So if you had a UTI 10 years ago and you remember that macrobid helped you, it doesn't mean that it will help this time around. For those women who experience frequent urinary tract infection, checking your urine during urinalysis and urine culture is especially important to avoid exposure to multiple types of antibiotics. Another important thing to consider when you're choosing the antibiotics is your general state of health. Some antibiotics can be too strong for people who are older or have chronic medical conditions. Some antibiotics might not be safe in a pregnancy or during a certain trimester in a pregnancy. So make sure you share your medical history with your physician before being prescribed antibiotics. Do I need to take antibiotics if I have a UTI? Actually, 20 to 30% of urinary tract infection will clear on its own, just with adequate hydration. However, in majority of cases, you will need to take an antibiotic. If infection stays in the bladder for too long, in some cases, infection might travel up the ureters into the kidney and develop a condition called pyelonephritis. In that cases, you might require stronger antibiotics through IV in hospital settings. Should I take antibiotics if I have a UTIs but I'm pregnant? Absolutely. Urinary tract infection can be very asymptomatic during the pregnancy. That's why your provider will be checking the urine every time you come to the office. Due to hormonal changes during the pregnancy, our urinary tract doesn't work the same and doesn't clear the bacteria as well as when we're not pregnant. Pregnancy is one of the predisposing factors for developing urinary tract infections. If infection left untreated, it can spread, and one of the serious complications that may happen is miscarriage or preterm delivery. In some cases, your doctor will actually put you on preventative antibiotics that you will be taking every day. What's important to remember is to tell your doctor at what trimester you are in, because some antibiotics are not safe to take in like first or last trimester, but totally safe to take in the second trimester. Urinary tract infections are very common conditions, and there are a lot of women who experience frequent urinary tract infection. No matter why you're having those recurrent UTIs, there are multiple options that can be explored. So make sure you talk to your doctor to see which one works best for you.